Unions and industry lobby groups have applauded a new mobile health service for our coal mine workers, which will help detect cases of the deadly black lung disease. The $1.2 million service, part of the Palaszczuk government's cash splash ahead of next week's state budget.
A terrible disease tantamount to a death sentence. Once thought eradicated, now affecting the lives of more than 100 Queenslanders. After decades of systematic failures in screening, the Palaszczuk government is finally taking independent assessments to those who need it most.
We're putting a van on the road to make it easier for coal workers to access that vital screening at where they work or where they live.
The $1.2 million mobile health van was a recommendation from the Parliamentary Committee into the re-emergence of black lung and mine dust disease. It will travel to communities around our region, screening and testing available to existing and retired coal mine workers.
We want independence so that the doctors that are doing the checks are independent and they just give the true and proper diagnosis, whether a person has got a disease or they haven't got a disease.
We fully support any extra health care that we can give miners, both those currently working in the industry and also those who have left the industry or retired.
The CFMEU says it's a positive step that could help save lives, but it's still waiting for the committee's other recommendations to be rolled out.
Screening's one side of it, but it's also the lower dust levels, the dust monitoring. The whole system's got to work together to be effective.
The Mines Minister says it's all part of 3 years of reform in the industry.
This is part of a raft of world-leading reforms we've put in place to prevent black lung and other dust diseases in our workers.
Laura Gardner, WIN News.